back to this anesthesia training series. I'm Dr. Marquis. I'm a veterinary anesthesiologist, and today I will be talking about sedation and general anesthesia for blocked cats. So blocked cats and dogs are something that we see all the time in the ER and in the ICU. They frequently have a bunch of different comorbidities, so I want to teach you how I approach these cases, things that I like to do for them, anything you need to watch out for, and helpful tips and tricks. So let's start off with, why would we need to pay particular attention to blocked cats and blocked dogs? Well, a lot of these animals come in and sometimes they've been sick for several days. They have some funky looking blood work. They haven't been feeling well. So not only do we need to treat their blockage problem, we need to treat their secondary illness. So in order to do that, we're going to need a couple different things to get this procedure started and make sure that we have a safe and pleasant experience for us, for the patient, and also for the doctor facilitating whatever procedure this is going to be. So I've put together here a shopping list of things that you'll need to get ready when thinking about these types of procedures. So if you are going to do a sedated or anesthetized procedure on any dog or cat, you need every single time the code status of the patient, permission for the procedure, a patent IV catheter, and permission for either, sedation or general anesthesia. Legally, you need those things, so you need to have that before you even get set up or started. There's a couple pieces of equipment that you're going to need to make sure that this goes smoothly. So in addition to your basics, you're going to need anesthesia monitoring equipment and ways to provide oxygen. You're going to need stuff to intubate with because sedations are frequently converted to general anesthesia where the pet is unconscious. In case the patient is uncooperative, it takes a long time, the doctor is having a difficult time getting the procedure done. So anticipate you will need those things. Just get them out beforehand, and then that way you don't have to worry about it. Things for the procedure that you may require: IV fluids, flush for the animal's bladder, urinary catheter equipment, and such. The exact specifics are going to depend doctor to doctor, so make sure you ask her all of those things before you get started on sedating the patient, if that is what you are doing. Other things that you might require for supportive care: active heat support. So lots of animals that get sedated or anesthetized get cold. Hypothermia is the number one cause of a prolonged anesthetic recovery. You don't have to let this happen to your patient, so have that ready beforehand. Other things that might be helpful: radiology requests submitted. So if you're going to place a urinary catheter in a dog or a cat, you're probably going to take x-rays, so make sure you submit those requests beforehand, and that way you don't have to wait when you're ready to get into radiology, and you don't have to leave your patient. Other things that might be helpful. So things that I like to do for black cats and dogs, I usually put epidurals in them, and I'll talk a little bit about that later. So epidural drugs and supplies. You are also going to need things to facilitate the procedure itself. So things like clippers, scrub, suture material if the doctor's going to suture in a U-cap. So think about all those things and get those all ready and sorted out before you even go to touch the patient. So I want to talk about a couple different drug options and some reasons why we might do that for either a sedation or a general anesthesia in these types of animals. So sometimes these animals are going to be nice. They're going to be cooperative. They're going to let you place an IV catheter. And you know what? If they do, that's great for you and for them. So if the patient is cooperative, what I want you to do is place an IV catheter, and after you've done all of these other things, gotten them ready, go ahead and sedate your patient. If it's healthy, it would be appropriate to use an alpha-2 and an opioid, and then get started on your procedure. If they're debilitated or they have a bunch of blood work abnormalities, then maybe it would be better to use an opioid and a benzodiazepine. Now, if the patient is uncooperative and you cannot place an IV catheter, you should sedate them IM first. So similar rules apply. If the patient is healthy, sedate them with something like an alpha-2 and an opioid, or if they're really sick and they're small, opt for something like maybe alfaxolone and an opioid. Now, with alfaxolone, you're going to be kind of volume limited, so think about that only for small patients. And if you have trouble deciding on a protocol, ask another doctor, ask me, ask an anesthesiologist that you know. And then, once the animal's sedated, place the IV catheter. A couple things that I want you to think about when getting drugs ready for these types of procedures. So you're going to need drugs probably to sedate the patient, maybe drugs for anesthesia if that's what the doctor's requested, but here's what you need to know. I want you to bring 1.5 to 2 times as much drug as you think you need, because sometimes it's not enough, sometimes the procedure takes a long time, and sometimes you require additional pain control. So don't just get 1 dose of drugs. Maybe get 2, and maybe get stuff to induce general anesthesia if things are not going your way. What I also want you to know are a couple of things about using induction drugs as part of your protocol. It's absolutely fine to use anesthetic agents like ketamine or alfaxalone as part of your protocol. They can be super helpful and will make the patient move, certainly a whole lot less. But what I want you to know about these drugs is that if you use them, you need to be prepared to intubate. So that involves having an IV catheter, that involves having permission for general anesthesia, and that involves having intubation supplies and oxygen equipment. So don't be giving these drugs without having those ready and having those nearby every single time. What I'll also say is that sometimes these procedures go along for quite a long time and the patient gets sedate, and then eventually they become anesthetized. And you'll know that if they have no jaw or tongue tone and the eye is down, maybe you should just intubate them. Because if they're just sitting there and they don't have any tongue tone, they also won't be able to swallow, they can't protect their airway, kind of a bummer. So if you use these drugs, just be prepared for that and you're not gonna have any problems whatsoever. So I want to talk a little bit more about the medical side now. So we talked about equipment, we talked about drugs, and now I want to address some of the major problems that we tend to see in these patients. So other than the patients being maybe uncomfortable, they've been sick for a couple of days, one of the things that we very frequently see in these dogs and cats is that they have hyperkalemia. So hyperkalemia is a problem where the animal has an elevated serum potassium. I personally would usually say this is above 6.5 millimoles per liter. And potassium can have a really important role normally, but when you have too much potassium, this can result in a couple of really detrimental effects for the pet. So a couple of them right here. Arrhythmias, so rhythm disturbances in the heart. There are many that you could see with hyperkalemia. They include, but are not limited to, ventricular tachycardia. So sometimes initially, as the potassium builds up, the heart becomes irritable and they will have a tachyarrhythmia. This is very common, particularly in cats. Things like sinus arrest and atrial standstill, these are things that happen when the potassium becomes really high. It is relatively cardiotoxic, so to speak, and basically what this results in is some bradycardia and some real slowing down on the ECG. So both of those patterns would be things to look for and to be able to recognize when working with these patients. Other things that can happen, so particularly in cats, things called escape rhythms. So to me, this is a heart rate less than around 130. So when you have a cat with a heart rate that is that low, you have to make sure that it is not an escape rhythm. An escape rhythm means that it is kind of an escape, so to speak. It is coming from the ventricles. It's kind of like a rescue signal. So this is a beat that has usually no P wave, it's wide and bizarre, and it originates from below the annulus. So things to look out for, things to recognize. Muscle weakness or apparent muscle paralysis. So this is something that happens either with very high or very low potassium. Sometimes with very high potassium in block cats, they can have some weakness in both their hind and their front legs. It's not a reliable indicator that there's a problem, but if you saw this in this type of patient, maybe you should check the blood work. Obviously, one of the most detrimental effects that we can have from high potassium is death. So like we talked about, potassium can be cardiotoxic, and if you don't address these problems, the patient will eventually expire from their illnesses. So I guess from here, how do we recognize and how do we treat that these problems are going on? Well, I've got a couple of lists for you. So how are we going to recognize that this is a problem? The blocked cat or blocked dog history? Yeah, maybe. The animal that comes in blocked for UCATH placement or things like that may or may not have high or low potassium. The history definitely tells you that they're at risk for that, but you're never going to know until you check the lab work. ECG changes in heart rate, also maybe. It's really important to remember that while ECGs might be able to tell us where the problem is, they're not specific and they're not always sensitive. So what this means is that if you see ECG changes, you could have a problem with potassium. But also, you could have a normal ECG and have awful potassium, like way too high or way too low. So don't just look at the ECG and assume it's going to be okay. Check. And the way you check is blood work. Blood work is the only reliable way for us to tell if the dog or cat has hyperkalemia, and this is very important to know. And kind of like I said earlier, the ECG could be normal, but they could still have problems. The heart rate could be normal and they could still have problems. So how about we just make sure and we'll know whether or not to treat it. We'll find out for sure. So how do I fix this problem? Like, how do I make the potassium not so high? Is that possible? Yes, it's absolutely possible. There's a couple of things we can do to make the potassium have a less detrimental effect on the body and also to drive it down. So, number one, check the blood work. So, if you are going to do your sedated or anesthetized procedure on your dog or cat and it does not have blood work, that would be helpful to get. And also, if it's been more than 2 to 4 hours since its last electrolyte check, I recommend checking that again before you start. Because if the animal sits and it's still blocked, what's going to happen is that the potassium will build up again. So you need to check it again. So before you get started, apply monitoring equipment. So applying things like ECG, blood pressure, things like that, because you want to have that information before you start giving drugs to change the electrolytes. Because like we talked about, we change the electrolytes, we change the ECG, we could do exactly the same thing while treating this. So we need to know. Okay, drugs to fix the potassium. So there's 3 main drugs that I think about when I'm doing this. One of them prevents problems from escalating for the time being, and the other ones actually treat the potassium. So the first step, give calcium. So calcium is something that we give animals with high potassium because it stabilizes the heart and restores resting membrane potential. It's really important to remember that calcium does nothing to the potassium. It does nothing to fix the actual problem. It only acts as a band-aid and it gives you some time to fire in extra treatments. So give the calcium to stabilize the heart, but then also have other treatments on hand. And those treatments are insulin and dextrose. So when you give insulin and dextrose together after your calcium, they will help pull the potassium into the cells. So that will help fix your problem. First, you stabilize the pet with the calcium, and then you actually treat the potassium. Now, you've given all these different things which will change the electrolytes and maybe change the electrical activity of the heart. Are there any things we should do after? Yeah, I think so. So I think if you've done these things and given these drugs, you should check blood work after the procedure as well. Usually as soon as 30 minutes to 1 hour after the procedure, you're going to start to see the effects of the potassium changing, and you just want to make sure that it doesn't swing too low. Like if it gets less than 3, maybe you need to give the animal some potassium supplement in their fluids, but it would just be a really good idea to check. Okay, a couple more things when we think about blocked cats. We've talked about setting up equipment, we've talked about medical problems, and we've talked about a couple of different drugs we can use. And I want to kind of build upon that drug protocol and talk about ways that we can provide pain relief by incorporating different drugs. So we have lots of different drugs that we can incorporate for these animals, both to provide sedation, general anesthesia, muscle relaxation, and pain relief. And something you can do to help with this is a caudal epidural. So I do caudal epidurals in all of my blocked cats for a couple of reasons. Number one, it's going to result in motor blockade of all of the structures underneath the tail. So this is going to make the structures under the tail so much easier to work with when you're putting in the UCATH. It is also going to provide total pain relief. So if the epidural works, the pet is not going to be able to feel the catheter placement or unblocking procedure. So this is really nice for the patient because it reduces their need for other drugs for you to get the procedure done. So there are a couple things we can do in order to get this done. I would recommend 0.1 mil per kilo total volume of drug. I usually use a local anesthetic, so you can use lidocaine, you can use mepivacaine, you can use bupivacaine. And the caudal epidural is going to be done at the first movable joint at the base of the tail. The technique is relatively simple. You only need a couple pieces of equipment to get this done, and usually with practice, it doesn't take very long at all. And if you're looking for more resources on how to do epidurals or maybe some of the local anatomy, I would recommend going to the NAVAS or NAVAS blog page and reading about epidurals, or go to our Teams folder at our 2 hospitals and reading more about the technique. But that is just another thing you can do to provide comfort, facilitate the procedure, and desensitize that area underneath the tail. So in summary, there's quite a few pieces of equipment that we'll need to get out before starting the procedure, but doing that beforehand is going to make us faster, more efficient, and safer when it comes to it. We have a variety of drug protocols we can use. There's no right answer, but think critically about whether the patient will be cooperative or uncooperative, and then plan your procedure from there. If your patient has characteristic potassium abnormalities, it's important to recheck those and treat those if indicated. And it's important to provide a balanced drug protocol, and that includes not just sedation, but things like analgesia in the form of a caudal epidural if possible. And that's it.